We're going live. Hello, everybody. Dr. Alex Earl here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. This is the time I get to spend with you guys and answer all your plastic surgery questions and go over some very, very interesting plastic surgery topics. Okay, so today we are live on Instagram, TikTok, and YouTube. Okay, yeah, so we look forward to participation from all groups, all right? And TikTok, send us some likes, send me some dinosaurs. I love those as well. Okay, so today we got a very important topic because we want to talk about, of course, patient safety, and I talk about this a lot. I've been doing this pretty much since I opened up Pure, which is way back in 2018. Okay, but as you all know, last week, I believe, I was speaking about the new rules and new laws actually here in Florida, which a lot of them relate to office-based surgery and specifically to BBLs. And since this law came out, which is now July 1st, I'm now seeing like all these like clinics and high volume kind of budget centers all of a sudden talking about patient safety, which they were never doing before, and even one of these places claimed to be the safest BBL in town. Okay, so it did irk me a little bit, and it got me thinking, like, really, like, what makes you the safest place, BBL in town? Like, are you're just talking the talk, but do you actually walk the walk? Right? And so I've decided today to I've come up with a few questions that you can ask so that you can gather some information and really tell if they actually have safety as your number one priority, or it's just a whole bunch of marketing and lip service. Okay. Me, for example, I've been talking about this in 2018. Those that are just meeting me today, you can go back to my Instagram, go back to our YouTube channel. You're gonna see me talking about ultrasound BBL, patient safety for the past 5 to 6 years. Okay, so it's nothing new for me. But all of a sudden, all these other people are now talking about it since these laws came out. All right, so here we go. So number one, so we're gonna go through like different subjects and different questions that you can ask, so you can really gather the true information. Okay, so first thing is, do they have a rigorous kind of pre-op labs and clearances and everything that they go through in order to make sure that the patient is healthy enough to have surgery in the office-based surgery setting, right? So certainly they gotta ask for several labs. You gotta ask for your hemo levels, your electrolytes, your how fast your blood clots. And they gotta ask for all those parameters, and they should be asking for a medical clearance from your primary care doctor. Okay, either primary care doctor, or someone that's examining you, looking at your medical history, your surgical history, and making sure that you're cleared for surgery. And then here, of course, is your hemo level as well. I would not go anywhere where they're accepting a hemo level less than 11, especially for like a big lipo 360 or BBL procedure. Okay. Ideally, your hemo level would be 12 or above. If the place has a cell saver, then theoretically it can go down. We could start with a hemo 11. Certainly, I wouldn't do anything with a hemo less than that. Okay. So any places accepting hemo levels less than 11 for lipo 360 or BBL, they're not really having your safety as their number one priority. Okay. And along with that, yes, I would ask if they have the cell saver. Okay. Cell saver is a machine that we use during lipo 360 and BBLs, where when you remove the fat, you get the fat, but you also get this bloody liquid, and then that liquid, you can run that through the cell saver. What the cell saver does is that it basically gathers all the red blood cells, and then you can give it back to the patient pretty much as an auto transfusion. Okay, so it's a great tool to minimize blood loss for the surgery. I highly recommend it. We've been doing the cell saver for many years, and I would definitely recommend going to a place that has a cell saver in place. Okay, all right, next I would ask them what their BMI limit is. If their BMI limit is certainly anything above 35, that's not having safety as a number one priority. Okay, because multiple studies have shown that as you get to a BMI really higher than 30, but especially higher than 35, the complications rates go way up, especially for serious complications such as blood clots, so DVTs and PEs, which can lead to serious complications, hospitalization, and death. Okay, so you definitely you would not want to go to a surgeon in a clinic except the BMI is above 35 because the complications rate there are very, very high, and you should not be doing that in an office-based surgery setting. So ideally I think it should be below 34. Even when I started several years ago, my max BMI limit was 34. Now I've actually brought it down to 30 to decrease that complication rate even further. Now I do understand some surgeons may want to go a little bit higher, so I would say that the cutoff should ideally be 34 in terms of the BMI. All right, your next question is going to be, are the surgeons board certified by the American Board of Plastic Surgery? Okay, I think that's an important question. That means that the surgeon's gone through the rigorous education and training and multiple years that it takes to be board certified. They've gone through a plastic surgery residency program. They've taken a written examination. They've then gone through what we call a board collection period. They've collected at least 50 cases. And then they've done their oral examination where they examine those cases, and they also ask a whole bunch of questions in the oral examination format. All right, so you definitely want to check that in terms of the board certification. Okay, now cases per day. Okay, yeah, different surgeons can do different amount of cases. Some surgeons can do 2, some surgeons can do 3, some surgeons can do 5, sure, but there will come to a limit where it's just unreasonable and unsafe to do, right? There is such a thing as surgeon fatigue, and it is a surgeon's responsibility to give it their all. So they must be giving it their all for their last patient of the day, the same as they do for their first patient of the day. Okay, and I think once you get into like 8, 10, 12, 15 cases in a day, you are going to be getting into surgeon fatigue, and you're not going to be giving it your all. So I would say that the number of cases per day for that particular surgeon should not be more than 5. And then, of course, now, with the Florida laws, they're probably saying that, but you should ask them. So I would ask the question, so how many cases do you do per day? And they'll say 5. And then you'll say, well, how many cases were you doing per day before the Florida law came on, right? And then, and they're saying, well, maybe it was more, maybe it was 10. They're like, why? Why were you doing that? Okay, why did you change it? Is it just because the law changed, or because you actually care, right? That's similar to the ultrasound here, right? We all know that using an ultrasound, you turn a blind procedure, okay, we're talking about the BBL, you turn a blind procedure into one where you can actually see, exactly where you're placing the fat, you know that you're placing it into that safe space. And the ultrasound didn't just start now because of this Florida law. It's been around for many, many years. I've been using it since 2019, okay? Because I wanted to have that peace of mind of knowing exactly where I'm placing that fat and making sure that it's in that safe space, okay? And so now, if you ask someone here in Florida if they use the ultrasound for a BBL, or they have to say yes because it's a law, okay? But then I would ask the follow-up question, well, were you using it before the law? Okay, and if not, then why not? Why weren't you using it before the law? Right? That's a good question. How are they going to answer that? So the other thing is, well, now that you're using it, do you know how to use it? What type of training did you do? Right? Did they go to like say for example the course that we do here? Right? I do a course every 3 months or so, training surgeons how to use the ultrasound for this procedure. So are they WAG certified? We give them a World Association of Gluteal Surgeons certificate when they come here and then do the course. So you can ask them if they have their WAG certificate in terms of ultrasound used for gluteal fat grafting. Okay. Or some other sort of ultrasound course certificate. But the ultrasound is not just something you just kind of pick up and just start using and you know how to use it. You got to go through some training. You need some experience. All right. So I've been doing this, like I said, for many, many years. Those are just picking up now. They've been doing it for 20 days. Right. The law started July 1st. Okay. Here's another one. This one. We are one of the few. Very few, if not perhaps the only clinic, I don't know any other clinic here in South Florida that offers CosmetiSure. Okay, so if you really care about your patient, right, you offer a backup insurance in case there is an issue, right? If there's a problem and you have to go to the ER or you have to go to the hospital, your regular insurance is not going to cover it because you've had a cosmetic or aesthetic procedure, okay? But that's why we have this backup insurance called CosmetiSure, which will help cover that, you know, any potential financial after you have to go to the ER or the hospital for whatever reason after cosmetic surgery, okay? And we provide this for all of our patients, 100% of our patients, at our own cost, okay? So why doesn't everybody else do it? Because it costs, and there's a cost to it, right? But we don't care about the cost. It's about the patient's safety, not only in terms of the patient themselves, but their peace of mind and their financial well-being, right? So this is something that we offer. I don't know of any other place here in South Florida, at least, that offers this for their patients, okay? Next question you're going to ask is, well, okay, tell me about your complication rates. For example, what's your infection rate? What's your lipoburn rate? Okay, what's your rate in terms of hospitalizations and deaths, right? You want to ask that question, okay? You want to make sure that the complications rates are low and ideally below the national average, okay? Complication rates, though, are never going to be zero, right? The only way, I do have to say that caveat, the only way to have a zero complication rate is to not do surgery at all. All right, so that cannot be the expectation, to have zero complications. But you want the complication rates to be as low as possible, okay? You want them to be below the national average, okay? Talking about complications rate, you know, you want it ideally be a place where they're very open about it. So as those of you that have been following me for many, many years know that I give my BBL stats at the end of every year. So every single December, I give my BBL stats. I talk about all the complication rates and how we compare to the national average. If you're just kind of getting to know me now, I invite you to go to my Instagram and then look at December, okay, from at least from 2020 or 2019. I don't remember when the first one was, up until now. Of course, 2023 we'll do this December, okay, but I've done it for the past 3 to 4 years, and you can see, okay, how I've been documenting that every single year, okay? All right, and then last but certainly not least, incredibly important, is what is your OR certification, okay? The facility, all right? Who's certifying that? All right, there's there's at least 3 levels to that. First of all, it needs to be certified by someone, right? If it's not certified, then it's illegal to do surgery there, okay? It's a big problem. So at the very least, it needs to be certified by the Department of Health, okay? The Florida Department of Health. That's kind of the baseline level to even just be allowed to do surgery, okay? So at the very least, it has to be certified by the Florida Department of Health. That's your baseline. Now, if they really are taking it to the next level, right? If they're really like walking the walk, not just talking the talk, all right? You can go to the next higher levels, all right? There's Quad ASF, and then the highest level of OR certification is what's called the Joint Commission, or JACO, okay? JACO. Now that's the highest level you can get, all right? It requires a lot more protocols, a lot more safety measures, okay? The survey, when they come and take a look at everything, is super intense, all right? It's really going the extra step, going the extra mile, and that's what we have here at Pure. So at Pure, we are JACO certified, one of the few JACO certified office-based surgery centers here in South Florida, okay? All right, so these are the topics you want to touch. These are the questions that you want to ask, okay, to see if it's really, that's really what they're all about, or if it's just lip service and marketing, okay? All right, questions?
The schedule for April, excited, that's a comment.
All right, yes, very good, very good. Schedule for what date?
Just April, just a month.
Okay, all right, looking forward to it. We got a few months, but we'll see you then.
Doug, after a BBL, can you really not see at all for 6 to 8 weeks?
Yeah, so the way that our protocol basically is that after your BBL, I don't want you sitting for the first 6 weeks, okay? Now, I know there's a little bit of kind of, I don't know if we call it controversy, but there's some people out there saying that, you know, it could be less. But I don't agree with that. Now, perhaps several years ago, it wasn't as important because several years ago, fat was being placed into or deep to the muscle. And when you place fat into that area, it is deeper and there's a more robust blood supply. And so the whole sitting thing didn't come into play. However, of course, as we now know, that is extremely dangerous. You don't want to be putting fat into or deep to the muscle. Okay, and so now we're limited to placing fat in that subcutaneous space, which is a safe space. And so now the fat is more superficial. It has less of a robust blood supply to the area. So the pressures of sitting now really do affect the fat. Okay, and so you want to do your very best in the first 6 weeks to avoid any pressure. So there's no sitting, no putting pressure on the hips, kind of laying on your belly to get as much of that fat to survive as possible, and to, you know, decrease the risk of the fat just being absorbed or creating what we call fat necrosis, all right, which is basically the death of the fat where it becomes then like a scar tissue or scar ball underneath there.
For TikTok, how safe is ultrasound?
So that's a great question, and the short answer is that it makes this procedure very, very safe. Okay. Now the more extensive answer is, okay, number one, why? Because the reason why, you know, you hear out there in some of these TikToks in the media and whatnot that the BBL is a dangerous surgery is that when fat is placed into or deep to the muscle, you lacerate or you go through potentially some large veins, the superior gluteal and inferior gluteal veins. And if fat gets into those veins, then you have what's called a fat embolism. And then that fat can travel to the lungs, essentially clogging up the lungs, and the patient can die. All right, so the key is that you have to place the fat in that subcutaneous space. Well, before, a BBL was a blind procedure, right? Because you're putting this long cannula into a space where you can't really see exactly where it is. All right, but the ultrasound turns a blind procedure into one where you can see, right? We use the ultrasound imaging technology to see exactly where that cannula is, and you make sure that it's in that safe space between the skin and the muscle, okay? And therefore, the complication rate, especially of a fat embolism, goes way, 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 way down, okay? I'm not gonna say zero because in medicine, nothing is zero, but very close to it, okay? And this is why this now, July 1st, has become a law here in Florida where everyone that does a BBL is mandated to use ultrasound imaging technology when performing this procedure. In terms of numbers, back in 2017, the mortality rate for BBL was 1 in 3,000, which was way too high. By 2019, it had come down to about 1 in 15,000, but that was only for in a study done from board-certified plastic surgeons and knew about the regulations and keeping the fat in the subcutaneous space, okay? But when you look at WAGS members, which is where I'm the president of the World Association of Gluteal Surgeon, and the goal of our association is to make this procedure as safe as possible. When you look at WAGS members, our mortality rate for BBL is all the way down to 1 in 26,000, okay? And when you look at specifically at WAGS members using ultrasound, the mortality rate is extremely low, approximately like 1 in 50,000 or so, okay? So yes, the ultrasound does make a BBL a much safer procedure.
Okay, is the anesthesia risky?
So general anesthesia nowadays, today, 2023, is actually very, very safe as well. Of course, we want to go to a well-qualified provider. We have certified nurse anesthetists here at Pure. They've been working with us for a long time. They are truly, truly excellent, have a lot of experience, and we highly recommend them. So yes, I do all of my procedures under general anesthesia, unless I'm doing something like very, very small or something like that. But really, I would say well over 90 to 95% of our procedures are done under general anesthesia, and it's all done very, very safely for you.
How many weeks until you can use a BBL pillow after a BBL?
So ideally, you can use it more liberally after the first 2 weeks, okay? But there are going to be times within the first 2 weeks that you have to use it, for example, for your flight home, and that's okay. So if you need to use it within the first 2 weeks, all right, for takeoff and landing in the flight and whatnot, that's fine. But don't, try not to use it too much. And then after 2 weeks, you can definitely use it a lot more liberally. And then once you get to 6 weeks, you can sit normally.
What are the best tips to a fast and healthy recovery after a tummy tuck?
Great. So, all right, best tips for fast and healthy recovery after a tummy tuck. Okay. So remember, when we do a tummy tuck, we're not just cutting out that excess skin, but we're also doing that muscle repair on the inside as well. So it's very important to keep that in mind. So some tips. At the beginning, you're gonna want to walk a little hunched over like this. You want to avoid tension where we did that muscle repair and along the incision. So you're gonna walk a bit hunched over, and when you go to sleep, or you're gonna be either sleeping in the recliner, or if you're in your bed, you want to have a few pillows behind your back, a couple underneath the knees, again, to relieve the tension in that belly area. Another good tip is, initially you're going to be in an abdominal binder. You don't want that abdominal binder to be too tight at the very beginning, right? Don't think of it as a waist trainer. It's just there to give you some support and to keep things snug, okay? But don't crank that abdominal binder too much, all right? You don't want to restrict the blood supply. Remember, you have a big incision. Things need to heal. They have to have adequate blood supply so they can get all the nutrients and oxygenation that they need, okay? Walking is extremely important to minimize risk of blood clots, and using our sequential compression device, which is the device that we put in the legs, which basically keeps the circulation moving and again also helps decrease the risk of blood clots. All of these things are incredibly important, and then of course you want to have adequate nutrition and hydration, drinking about 1 gallon of fluid a day to make sure you're adequately hydrated.
What's the best way to maintain or gain weight in a healthy manner before a BBL without eating junk food?
Without eating junk food, right? It's a good question, all right, because after your BBL, we're going to ask you to at the very least maintain your weight. Sometimes you can gain a little bit, but you want to be between your baseline weight to plus 5 pounds. That's a good range to be. You definitely don't want to be below your baseline weight, and you don't want to go crazy, right? You don't want to be gaining 20, 30 pounds, right? You don't want just eating junk food and gaining crazy amounts of weight. That's going to take away from your result as well. So the ideal place to be is between that baseline and plus 5 pounds, okay? So how do you stay there? You definitely want to increase the healthy fats in your diet. So you want to increase things such as avocado and salmon, macadamia nuts, all right? Some red meat as well. And some milk products, okay, and eggs. And if you do have to kind of just increase your calorie count a little bit, it is okay to have the occasional, milkshake or ice cream. Or if you want something that you can kind of get off the shelf, you can do some Ensure or Boost as well, okay? So you can maintain that caloric intake, maintain that protein intake, and not lose any weight.
How many days do you have to stay in Miami after your procedure?
Great question. So it's very important to not leave right away, okay? So like I mentioned before, we do all of our procedures under general anesthesia. And so because of that and also the big surgery that you just had, you can't leave Miami for at least 5 days after the procedure, okay? That's the key thing there. So it's not about your total stay, is that you have to be here a minimum of 5 days before then getting on a flight or heading back home. Flight or a drive. A long drive is the same as a long flight, okay? So you have to be here at least 5 days. So there have been several papers, and there's actually a white paper that's given to us. I'm a member of the American Society of Plastic Surgery. And so there's a white paper there that states that after, if you're within the 5 days, the complication rates, including blood clots, DVTs, and Ps, is way, way high. It's unacceptably high, so you have to be here at least for 5 days. And that continues to trend off the longer you stay.
Okay. How long do you have to stay at the hospital?
At the hospital, 0. So we do all our patients, this is what we call office-based outpatient surgery. So it means that you go home the same day, or you go, you leave the facility the same day, right? So you go to your caretaker basically, right? So you're not spending any time at the hospital. You have your procedure, then you're going to be in a recovery room. You're there for at least an hour. If you need a little bit of longer time, that's okay. But you're not expected to be here for an extended period of time, and certainly not overnight. And then once you're feeling a little bit better, more awake, then you get discharged to your caregiver. All right, and then you guys can go, home if you're from here in South Florida, or if you're going to a hotel, Airbnb with your caregiver, or a recovery home.
Why do tummy tuck before lipo 360, or why not all together?
Yes, so I highly, highly, highly recommend doing your tummy tuck first, okay? If you have loose skin, if you have muscle weakness or separation, I highly recommend doing the tummy tuck first because that's gonna, take care of the muscle separation and the weakness, which a liposuction is not going to do. And it gets rid of all that loose skin so that the skin is now tight, and then you're gonna have a much better lipo 360 BBL result after that, okay? If you do it the other way around, if you do the lipo first, you're not going to be happy, because your belly's still going to bulge out because the muscles are still weak and separated. And you're not going to be happy because skin that is loose, okay, loose skin with poor elasticity, does not retract well. What ends up happening is that some parts retract better than others. It ends up looking lumpy, bumpy, and uneven. And I know a lot of patients, they want to say, oh no, the lipo is uneven. And no, that's not what's happening. What's happening is that your skin was loose, it was poor quality, and it didn't retract well, and so it looks uneven, okay? And so then the way to fix that, it's gonna have to be a tummy tuck after. But when you go in to do the tummy tuck after, you already have a whole bunch of scar tissue. The skin is not as easy to pull down, and so now you're gonna have less skin removal with more irregularities from the scar tissue from the lipo before. So honestly, you're gonna have a worse result overall. So I always recommend doing the tummy tuck first and then coming back and doing your lipo BBL. And let me put it this way, because then people are gonna say, oh doctor, am I gonna have enough fat? Yes, you will have enough fat 100% of the time. That is a myth. The myth that you do your tummy tuck first, you're not gonna have enough fat, is not real, does not exist, okay? I have never had a patient that did not have enough fat after I did a tummy tuck, okay? You are going to have enough fat. And then the other myth out there is like, okay, if I do my tummy tuck after, then will my skin get loose again? And again, another myth, not true. All right, the tummy tuck is done well and it's really stretched down. Okay, it does not become loose afterwards. Okay, so those are two myths that are just not true. Okay, all right, I've done a ton of tummy tucks and then BBLs, and I have never had any issues with the amount of fat that I need, or having to go back to redo the tummy tuck. But what I have had is a bunch of people that I've said I recommend to do the tummy tuck first. They don't really want to do that. They do the lipo 360 first or their BBL, and then they look lumpy, bumpy, and uneven, and then they want to do something about it. So now we're having to do the tummy tuck after. Okay, and then it becomes really tough to stretch that skin down, and there are irregularities and things like that from the fibrosis and scar tissue and inflammation from before.
Wouldn't body tight fix that skin to retract?
Body tight can only do so much. So yes, if you have mild to maybe moderate skin laxity, okay, then the body tight is a good tool. But if you have, higher, moderate to severe, the body tight's not going to do that for you, okay? You cannot think of the body tight the same as the tummy tuck, all right? The tummy tuck is obviously more aggressive, and if you have severe skin laxity, that's the way to treat it. I always tell my patients that the body tight can do only about half or 50% of what a true, what a tummy tuck would do, okay? So yeah, if you have mild to like low moderate skin laxity, then yes, the body tight is a great tool. It's a great tool for your belly, your chin, your arms, your thighs. Okay, but if you have higher moderate to severe, that's not the best solution. You're going to need some sort of like cutting procedure, like arm lift, tummy tuck, etc. Okay, all right, that's it. 30 minutes already.
Yeah.
My lord. All right, awesome. All
But
right,
if you
everybody.
have time, you can remind how to book a consultation with us.
Yeah, of course. Well, yeah, that always comes up. So, Doc, how do we get a consultation? So, first of all, know that we have three types of consultations. One is what we call your virtual consultation, where you send in your questionnaire and your photos. The second is what we call a video consult, where we're talking kind of like this, face to face in the camera. And then, of course, the third one is your in-person consult. So we do have all of those that are available. Of course, there's different costs to each. But even though all of those are available, the easiest and fastest and most efficient way to get started is to go to our website. You're going to go to our website, www.pureplasticsurgery.com, and you're going to find a button there that says virtual consult. All right, it's okay. Don't worry if you want an in-person consult. It's fine. Hit on that button, fill out the questionnaire, send your photos, and then one of our coordinators will reach out to you, okay? And she'll take it the rest of the way. She'll answer all your questions. She'll set up the in-person consult if that's what you want. She'll go through what procedures you're looking for, et cetera, et cetera. She's gonna give you a ton of information, answer all your questions, and get the process started, okay? So that's the best way to do it. All right, the other thing is I wanna give you guys a little teaser here. We got a lot of great things coming up here at Pure Plastic Surgery in the next few weeks to months, okay? A lot of great things, a lot of things that you guys are gonna be extremely happy about. Some of these things are things that you guys have been asking for a long time. For example, like, how do we get better organized for our post-op care? Like, we get that question all the time, right? So we have a lot of that coming up. I'm really excited about it. So please, guys, stay tuned because it's going to be great. All right? All right, everybody. Well, I look forward to seeing you all next week on Hump Day with Dr. Alex Earl. Ciao.
Great.